Services Management for today, 1st April 2026. The focus has moved from simple physical guarding to a high-stakes digital fortress model, blending AI-driven surveillance with strict new regulatory mandates. 1. Mandatory CCTV compliance, 1st April deadline. As of today, 1st April 2026, the sale and deployment of non-compliant CCTV cameras in Indian healthcare facilities are officially prohibited. Times the STQC mandate. Under the latest Matwai memorandum, hospitals must ensure all new CCTV procurement conforms to essential requirements, as Times why it matters. Non-compliant systems are now legally classified as cybersecurity risks, potentially serving as backdoors for hackers to access sensitive patient records. Times action for managers. Audit current surveillance expansion plans immediately to ensure STQC certified hardware is used. 2. The real-time hospital revolution. Security is no longer a reactive wait-and-see department. In 2026, the trend is real-time healthcare environments. Times visual verifiers, integrated systems now link IoT, Internet of Medical Things, sensors, like ventilator alarms, directly to the nearest camera feed. Times AI analytics. Modern cameras use edge computing to detect falls or PPE non-compliance instantly, sending alerts to mobile devices rather than requiring a guard to watch a wall of monitors. Times operational wins. Hospitals using these integrated command centers report a 25% reduction in manpower requirements and a 15% faster response time. 3. Regulatory overhaul, HIPAA and 42 CFR Part 2. Security managers are facing the most sweeping regulatory updates in over a decade. Times HIPAA Security Rule, 2026 update. The old, addressable, flexibility is gone. Previously optional safeguards like multi-factor authentication, MFA, network segmentation, and encryption at rest transit are now mandatory. Times substance use privacy, new rules for 42 CFR Part 2, effective February 2026, means so data no longer needs physical segregation but requires extremely granular, role-based access control. Times new reporting timelines. Proposed rules include a 24-hour incident reporting requirement for business associates, drastically shortening the window for security teams to react. 4. Emerging threats, ransomware and lawsuits. The cost of failure has spiked. Data breaches in healthcare are projected to cost an average of $12 million per incident this year. Times double extortion. 96% of ransomware attacks now involve stealing data before encrypting it, putting patient privacy at permanent risk. Times legal pressure. 2025 saw a massive jump in class action lawsuits, with 14% of incidents now resulting in legal action, even for smaller breaches. Times resource gap. In regional areas like Punjab, India, deployment of additional security guards, approx 200 new posts, is being pushed to restore safety for night shift doctors facing rising workplace violence. Daily summary. Times it's 1st April. Is your hospital compliant, or is your CCTV now a liability? Times key stat. Workplace violence accounts for 73% of non-fatal injuries in healthcare. Times the big shift. Move from guards at the door to AI at the edge. Times security is now a board-level conversation tied directly to patient safety and enterprise reputation. CTA, which of these trends will have a major impact on patient care this year? Let us know in the comments. Subscribe to my channel for more. Disclaimer: the information must be verified before use. The creator, publisher and YouTube will not be liable for any negative consequences.